Good morning. My name is Dr. Anton Porsteinsson. I'm the William B. and Sheila Kohner Professor of Psychiatry, Neurology, Neuroscience, and Medicine at the University of Rochester. We are here in Barcelona attending the ADPD 2022 meeting. In the last couple of days, we've heard several updates about new developments in Alzheimer's disease, both in terms of preclinical findings as well as clinical research. One of the main updates were on the aducanumab development that is now provisionally approved in the US, in Qatar, and the United Arab Emirates. The publication of the pivotal data was just released yesterday in the Journal of Prevention of Alzheimer's Disease, and this has been a long wait. We also heard data from the extension study, or the open label extension study of their phase 3 trials, that suggested that longer term use of aducanumab was associated with further amyloid plaque reduction and further lowering of p-tau, biomarkers that reflect on the severity of the disease, both pathologically and increasingly, we believe, have a correlation with clinical outcomes as well. So while there is some greater clarity about the impact on the pathology of Alzheimer's disease, as well as on the clinical outcomes, controversy remains about the safety profile, especially for patients that carry so-called APOE4 gene. We expect to see data from competitors such as the Eisai and Biogen agent lecanemab that is now in phase 3 development, also for gantenerumab that is in phase 3 development from Roche and Genentech, as well as donanemab from Lilly. Basically, we expect top-line results for these drugs at the end of 2022 for lecanemab and gantenerumab, and around mid-2023 for donanemab. And this will be important because if these data are positive and they show clinical efficacy, that will support the proposition that humanized monoclonal antibodies targeting amyloid plaques are of clinical relevance. But if these studies are negative and do not show a clinical benefit, then the question remains if this approach has a role in Alzheimer's disease or not. So the next year is going to be quite exciting in the field of Alzheimer's disease. But we are moving beyond just antibodies for amyloid plaques in Alzheimer's disease. At the meeting, we also heard about the biomarker impact of an open label trial with ALZ 801 from a small company called Alcyon that showed a significant impact on downstream biomarkers, particularly p-tau. And that drug is currently in phase 3 development for patients with early symptomatic Alzheimer's disease that are APOE4 homozygote carriers. There are multiple other medications in development that go beyond amyloid, such as tau targeting agents. The tau antibodies have been disappointing so far, but there are tau antibodies that have different binding characteristics. What that means is that they target different subspecies of tau that hold promise, as well as messenger RNA targeted strategies and small molecules for tau treatment. Furthermore, there are small players in the field such as Athera with their hepatocyte growth factor / MET receptor complex targeting drug, and Cassava with their drug called Simifalam that targets filament A as a scaffolding protein. That is, that it helps this protein, filament A, maintain its structure. In addition to that, we are seeing significant increase in the understanding of biomarkers, be that imaging biomarkers such as MRI or PET biomarkers, PET scan biomarkers, as well as CSF and blood biomarkers. And we hope that blood biomarkers may be able to take over from these other more expensive and intrusive biomarkers. That's the PET biomarkers and CSF biomarkers that require significant infrastructure and complex opportunities or in terms of being able to collect that data. So the availability of plasma biomarkers will really democratize the field of Alzheimer's disease, both in terms of diagnostics, research, and clinical monitoring. And this will allow communities that have less resources to take part in both the pivotal research as well as future trailblazing clinical care options, so medications. In addition to this, what I would like to do is to encourage everyone to follow the field of Alzheimer's disease in terms of clinical diagnostics and clinical care, and understand that we're in a phase of immense discovery, which means that the capacity for research worldwide is being saturated. And what we will see is basically that clinical trials will become more global. And I would encourage the audience here to be open to participation in clinical trials, be that as clinical investigators, if the opportunity arises, or as participants, if you meet entry criteria for some of these studies. And what is important to realize is that we're no longer just focusing on people that have clinical symptoms consistent with Alzheimer's disease or mild cognitive impairment. More and more, we're seeing clinical trials that target middle-aged or older individuals that have no clinical symptoms, but may have biomarker findings or genetic composition that increases the risk of developing Alzheimer's disease in their lifetime, and we intervene with preventative strategies.